Hello, everyone. My name is Seth Green, and I am the founding director of Loyola's Baumhart Center. And it is a joy to welcome you to Building Cross-Sectoral Partnerships to Address COVID-19, a webinar that is co-hosted by the Quinlan School of Business and the Parkinson School of Health Sciences and Public Health as part of the shared commitment between these two schools at Loyola to address this moment, which has both health and deep economic implications. To give you a sense of what we're going to be talking about today, we're going to start with an opening from our dean at the Quinlan School, Kevin Stevens. We're then going to hear a strategic overview from founding dean Elaine Morrato of our Parkinson School of Health Sciences and Public Health. And then we're going to hear 3 case studies that are in different ways using a cross-sectoral partnership model to drive very important and significant impact in this difficult moment. And then we're going to have time for questions. And so we invite you to ask questions via our chat function, and we will do our best to get to them when we come to Q&A. This is part of a series, and we cannot yet tell you all of the topics that will be coming up in the series because we really want to be responsive to the needs that you see. And so the other ask of you along the way today is to chat us on ideas that you would like to see for future webinars. We will be taking all of those back. And as we look to the future, we are aiming to really be responding to the needs that you see from both a health and a business perspective. And with that, let me turn it over to our dean, Kevin Stevens. Kevin?
Thank you, Seth, and welcome everyone. I will be brief, but I think we have a unique opportunity to bring together 2 great schools, the brand new Parkinson School with a dean who brings both health expertise and a great deal of business knowledge to the table, and of course the Quinlan School of Business. This pandemic has shown all of us clearly that expertise in supply chain and data analytics and fields like that are extremely important. Beyond that, on behalf of Elaine and myself, we'd like to offer the services of the entire university as we all work our way through this crisis. I know all of us have been to university, but when you're out for a while, you tend to forget how crazy universities are. They're really unique. It's really a unique organism. So we have expertise in all kinds of fields. We have paleontologists, and we have physicians, and we have poets, and we have project managers, and we've got political scientists, and that's just the peas. So we bring a wealth of knowledge and information here, and we are in a unique partnership, I think, to have a business school and a school of public health and health sciences join together to address this huge societal crisis that we are in right now. So welcome to this webinar. We are looking forward to hearing from you what you want us to help address. And with no further ado, I will turn it over to Elaine.
Thank you, Kevin. Next, I guess, slide. Hi everyone. And I just want to extend my welcome as well to everyone for taking a moment here out of your very busy days. And as both Seth and Kevin have said, our hope here is that it might kick off a series of convening conversations where we can dialogue together. I thought, as a way of opening up a strategic overview, just grounding ourselves in a few key concepts from population health management, and to share with you a science-based roadmap that has been circulating in the public health field and is being used as a template to guide business and public leaders in opening up their own local communities. Next. So if this were a public health class, we always start out with an overview of what is our U.S. health system, and it's a mosaic of many interdependent actors and agencies here in the United States. We have a division of government between federal, state, and local agencies and governments, and nowhere has that become so evident as we watch every night on the news and see it play out for us. In some ways, this is a strength in our resilience, and that by having many actors and interdependent folks, we're all thinking creatively, but it does bring challenges to how we actually coordinate together in a time of crisis in particular. And some would say we have a fragmented health system that gets in the way of improving health. Next slide, please. The other key concept that comes from population health is this one of social determinants, primary driver of health. We spend a majority of our healthcare, our dollars and resources on healthcare delivery. It looks like it's not projecting right on the legend there, but genes and biology account for maybe about 5% of our population's health, medical care for 20% would be individual behaviors like washing hands, wearing masks, but 55% is estimated to contribute as social things, the environment around us, our community, our economics, our education, our physical environment are more determinant of health than necessarily the medical care we receive. And so the focus in public health, next slide please, has been very on this concept of upstream social determinants. Instead of just focusing on the downstream where we have delivery of care, case management, how can we as public health be partnering cross-sectorally with the business community, with schools, with governments, with individual social groups in order to work upstream social determinants in a strategic way. Coming here to Chicago, I was excited to be learning about already the wonderful things that Chicago and the state are doing. I pulled this slide and borrowed it and want to give a shout out for the Alliance for Health Equity that is already well on the path in this endeavor and using this framework as we think about improving health. I share this with you because normally a public health dean would say, this is great, now how do we work together? But we have to remember these things now as we move forward on the journey in the COVID as well. So next slide. I thought it would be good just to remind ourselves what is it we know and what is it we don't. And my screen is doing some funny things, so I hope it's not for you as well. What do we know? Well, we know that it's deadlier than the flu, but we also know that it's very similar in its transmission. So that's good news. These established mitigation strategies are working. All of the social distancing is flattening the curve. We see that here locally. We see that here internationally. But the novel continues, that virus continues to surprise us. They teach us, and we're still learning. And learning about who's really susceptible, learning about how long immunity might last or not, learning about people without symptoms passing it on. And so that's the real-timeness of how we're trying to respond. But we know what indicators to look for. This is Public Health 101. And we know that we should expect outbreaks. And so that's why we envision this being a series of webinars along this journey of recovery out of where we are right now in the crisis and more on a pathway to the recovery. So next slide. I wanted to share this next slide, which and make you aware of a report that you can download. I think it provides an excellent framework for decision makers. This is developed by the American Enterprise Institute by former leaders of the FDA and the Centers for Medicaid and Medicare, and thinking about it as a phased approach with goals towards slowing the spread, reopening. At the time they came out state by state, I think what we're seeing is more economic zone by economic zone. Hopefully establishing protection via vaccine or herd immunity, and then really thinking really future forward. What have we learned from all of this so that we can build the infrastructure to minimize impacts of this in the future? Where we are is in the slowing the spread right now, and a lot of effort that's gone into flattening the curve while trying to ensure that we are meeting needs of health equity. And everything you hear in the news right now is focused on testing capacity, both whether or not you have the coronavirus or whether or not you may have antibodies and so forth. And we've certainly heard a lot about our healthcare system resilience, our nurses, our physicians, our healthcare providers in terms of capacity. So this roadmap here is going to be serving as our roadmap for the webinar series over time. And we want to make sure we're providing just-in-time information for you all as we go through those different phases together. Next slide, please. Where we are right now and whether or not we're able to move forward to this next phase, what we'll call phase 2 or reopening, is are we seeing evidence of a sustained reduction in cases, in this case 14 days because of the incubation period? Are hospitals able to step down from crisis mode to more management mode? And do we have we ramped up and scaled all of the testing that we need at the frequency and the volume of testing that we need to really do, as I said, Public Health 101, which is this case identification and quarantining and things like that. By having that kind of system in place, we're able to do active monitoring of confirmed cases and their contacts. So this is what public health folks are looking for. What is the evidence that says that we've slowed the spread? Next slide, please, so that we're then able to go to the next phase of reopening. And this is where I believe the cross-sectoral systems and collaborations are going to be most critical. We have to use the public health capacities that I just required in terms of our information system, knowing who is testing positive and so forth. But we also need to be working closely with businesses as they develop their own local individual plans at their own work sites as we relax distancing measures while still ensuring physical safety of employees, while also ensuring safety and health of vulnerable populations, which may be our customers, our students, ourselves, or those in our family, and really trying to understand who, are we building a herd immunity? Are folks that have been exposed to it sustaining their immunity such that that's a piece of the equation and looking at the resilience of the whole system. So these are the point and time we are right now. Where are we in Illinois? Well, we have please go forward. 1 week left on our stay home order, and I'm sure everyone is watching very closely at what's coming out of the governor's office in terms of his press briefings. I have a quote from a couple of days ago. We may not be at the peak, but we're certainly on the back end. I know cases are doubling more in the 7 to 10 day range, which is very good. But we also know we need workers to feel safe before they want to return back to work, as well as students here at the university. We hear this all over the news right now. A couple of weeks ago, or even a week ago, states are now starting to partner in economic zones to think through how we might implement on this. And so this is very much in the front of mind. I'm sure many of you are working on this in your own local environments. Next slide, please. And this is where the challenge is. What is an easy thing to answer? I apologize for the formatting that may have not come through okay as we went to Zoom. The what is the science, the how is the tricky part. And from there, every local community, whether that be at a national level or at a state level or at our very local city level, is going to be looking at what resources and assets it can be bringing to bear. How do we adapt and tailor this roadmap to meet the needs and the unique ways people work in our community? And is there social and political will to actually carry forward with all of the activity and working? Next, please. And so I'm going to close out and bring us back to where I started, right? We are a puzzle piece. We're made up of government actors. We're made up of healthcare system providers, healthcare settings, individuals, employers, schools, non-governmental agencies and organizations, community groups, as well as innovation in pharma, biotech, M-Health, digital health, and academic. And really, our resilience in Illinois and Chicago, as well as across the country, will succeed to the degree to which we really can come together to solve this problem of how do we implement on these steps together. And so I'm really excited to hear from our speakers today as to what they've already learned in the process here in Chicago. Next slide. And I just want to say we are a new school at Parkinson School of Public Health, and our founders, Bob and Betty Parkinson, challenged us to say, how are you called to be different? And I think I like to sum it up to say we're called to be health entrepreneurs. And that's why I'm so delighted that we have the opportunity to work with Quinlan and to work with the Baumhart Center and really approach this in new and different ways of how we think about responding to COVID, but how we also think about responding to all of the great challenges in population health. And I include this quote here from an inspiration in terms of the lean startup tech world. You know, we're in a moment of pivot, right? Where we're not changing our vision of community health and health equity, but we might have to change our strategy of how we get there together. And so that's in front of our mind, and I look forward to hearing what you all have to say. Next slide, please. And really, it's a chance. Our formatting has not come through. I apologize again.
This looks beautiful outside of Zoom,
it looks,
so everyone knows.
It does.
perfectly spelled.
Yes.
There is no grammar. It is a gorgeous slide, just not showing up that way.
Right. You'll all get a copy if you want one. But it's really a partnership. I'm trying to say it's this beyond our the crisis management series. We hope it's an interface so that we can be talking together, not only between business and public health and health science community, but with you, our business, population health, and community partners, and that we can journey this together across all of these phases as we move towards rebuilding our readiness and strengthening both our health and economic resilience. The last slide is just to introduce, because we won't be able to get into all the cool things about the science of this, and I just want you to know, if any of you are interested in learning a little bit more and you want to dig down deeper in terms of emergency preparedness, whether it be in a public health or a healthcare work setting, or wanting to understand more about the infectious disease kinds of aspects of this, but want to do it in a very simple way so that you can just be a good person interpreting the science. We offer some new courses this summer for all learners, and we may be following up with information with you just to learn more. But I'll stop there and hand it back over to Seth, and I really look forward to hearing the case studies. Thank you.
Well, thank you so much, Dean Morrato, and I think you have provided the charge for the next section, because you have made very clear that cross-sectoral partnership is essential because we need all sectors working together to address this. And so we're going to look at 3 such partnerships, and we're going to start with Sean Garrett at the United Way that is working on this on 2 levels, on both the fundraising to try to deploy in a rapid way to the nonprofits out there who are on the front lines, as well as through collective impact strategies that were developed beforehand but are coming to be even more meaningful in this moment. And so let me turn it over to you, Sean, to walk us through your presentation.
Great, and thank you, Seth, for the opportunity to be with everyone today. We really appreciate it and appreciate all the work that's taking place in our community. I have the privilege of leading our United Way here in Chicago for the last 18 months, and I'm going to start us, frankly, right before COVID. Prior to the COVID experience, we were working really hard, neighborhood by neighborhood, to impact communities and to provide, chances for kids and families that weren't based on the zip code that you're born in. And so if you go to the next slide, I want to show you just a quick map of kind of the way our community is structured. And this comes from research from Raj Chetty. A number of you have probably seen it before, but what it looks at is the impact of where you're born. This is for male children who are born between 1978 and 1983, who are born into a low-income family. And then it shows where they are economically 35 years later. And for those of us in Chicago, you see a familiar pattern. The darker red means that they're doing worse off than they were born into. And the blue and green colors are showing doing better off. And so simply being born on the south and west sides of our city puts you at greater odds. And, Mayor Lightfoot during her campaign often would say that zip code shouldn't determine your destiny. And, maybe it doesn't determine it, but we show this map all the time. It certainly predicts it. And I think that's something that, when we look at, we say, so what can be done about it? And what was very clear and what the research has really pointed us to is it takes holistic partnerships in neighborhoods. It's why we've been proud for over 7 years now at United Way to work neighborhood by neighborhood, really helping to build clear community plans, have partners who are leading day to day at the community level. We're building out coalitions of nonprofit partners and who are helping to bring together multiple sectors. And if you go to the next slide, towards the end of last year and leading into this year, we were seeing great momentum. We had Mayor Lightfoot launch her Invest Southwest Focus, an investment of $750 million over 3 years in 10 targeted communities. The day that she announced that, we were so proud to stand with Dave Casper, who's in this picture with us, and BMO, one of the leading financial institutions in our community, making a $10 million commitment to our shared work in Allston. Since then, we've had a number of companies come together to form, a corporate coalition, looking at what can they do, not just in philanthropy, but what can they do from a business perspective to help grow and develop these communities in partnership, though, and this is the part we don't want to lose, with folks like Darnell Shields. Darnell is the gentleman in the blue tie. And, Darnell's waking up every single day in Allston. He has a clear plan that he's worked with his community over a 2-year period to put in place, and they're executing that plan. And what they needed was resources being philanthropic, resources being support and expertise. And this cross-section of partners has come together, whether they be the business community, the government community, the nonprofit community, to help bring that to life. And right before COVID was happening, we were in the process of building out 4 specific projects that are beginning to transform, the look and feel of Austin under Darnell's leadership. And it's really a community-driven approach, but that's supported by everyone. I think that's been a really proud thing for us. But what's been really interesting is it's continued through this. And so the partnerships that have been built didn't stop. And so if you go to the next slide, I'm going to show you the same map again. And when you look at the map, the reality is this could also be the map of COVID cases and deaths in our city. As we've seen, it's disproportionately impacted the African-American community. We also know that some of the economic impacts has disproportionately impacted the Latino community. It looks very similar to what you see here. And so though we don't use this map necessarily to talk about the health kind of outcomes, the reality is it's determining them just as well. And so if you go to kind of how we've responded and how our community has responded, a few days before the stay-at-home order came out, we, along with the mayor's office and the Chicago Community Trust, came together and said, we think there's an opportunity to bring together resources that can be quickly deployed. And we didn't know what was happening at that stage. We didn't know what was going to come next. And we didn't know if anyone was going to come with us. But we knew that there needed to be a way for resources to come together and get out quickly to organizations who are doing work across our region. And in a matter of days, we had raised $8 million. By the end of that first week, we were at about $15 million. And just this morning, we announced that we've been able to raise over $25 million. And what's been amazing about it is it's not from one big donor. Yes, there are folks that have been able to make significant gifts, but it's a cross-section of our community. You've got businesses that are making investments. You've got foundations that are making investments. But you have folks that are making $20 and $10 investments every single day, who are saying, even in the notes that they send to us, saying that, I know it's not a lot, but it's what we can afford, and we know someone else needs it more. And that's been a really powerful message for us as a staff, but also our partners, knowing that this is something where the whole community is coming together. To date, we've been able to approve $9 million in grants. That's about 140 grants. And just on Monday, we closed the third round with over 740 applications. So just think about that. 740 applications came in from organizations that are focused simply on the emergency response. This isn't even the broader nonprofit community. This is simply based on the emergency response. But one of the things we're seeing, and this is why I started with our original conversation around the economic impact that we've seen in the partnerships in Austin and other parts of our community, is those very same community hubs that have been built to help kind of address the issues of inequality across our region are today responding in a time of crisis. So Darnell, who I pointed to earlier, is now helping to lead Austin's response and helping to listen to families and ensure that their needs are met as quickly as possible. That wasn't what they were set up to be, but because they've built these trusted relationships and these trusted partnerships, they are a voice of the community and for the community, and we're seeing that across the region. And so while we're right now focused on this COVID response, we know that the work that we started before is actually helping us in the response by creating this community infrastructure, and is going to help us get to another side that is much more equitable and doesn't return back to the normal where we were before, but hopefully returns back to a normal where these communities aren't, and where zip codes aren't defining their destiny. But frankly, these communities are thriving in the way that all of us want them to be. And so we're very proud of these partnerships and grateful that others have joined and others have brought really the different expertises that they can bring to the table.
Well, thank you, Sean, for your presentation. And as someone who sits on the campaign cabinet with United Way, I just want to say your team is amazing in this moment. I am blown away by the tireless efforts that your team is making so that others can be tireless on the ground level to help others. So thank you. And, if you are helping to address this work at its kind of most symptomatic level, there is another partnership underway that is trying to move a lot of those people who have lost jobs back into work. And so I want to move now to Daniel Cervantes and the cross-sectoral partnership that he leads as SVP of Skills for Chicagoland's Future. And I'd be remiss if I didn't also mention that another title that Daniel has is Baumhart Scholar, because he is one of the members of our inaugural cohort who we are so proud of. Daniel, let me turn it over to you.
Thank you, Seth, and good afternoon to everyone on this call. I appreciate, Seth, you along with Loyola University putting this together. Definitely a topic that is of front of mind to, I think, everyone in the various communities here in Chicago. So if we can move to the next slide. Thank you. I'd like to start by saying that, Skills for Chicagoland's Future, so our organization was actually, interestingly enough, created and was a result of the 2008-2009 financial recession. It was built on the premise that, the majority of jobs that are filled today, and even when you go back 10 years ago, have historically always been through networking. And so for us, when we built Skills for Chicagoland's Future, it was about how can we be a voice and be that network for those that don't have a voice or lack the access points to job opportunities that exist out there. And so for us, we created the organization with the mission of creating demand-driven solutions for employers to get the unemployed back to work, and it's starting with the job. And the point of showing you this slide that you see here is really around what Sean talked about, is that access gap, right? Your zip code should not determine, the economic mobility and opportunities that are in front of you. And what you can see is our work has been focused organically on serving the residents, over 7,500 now residents, coming 70% of them from the south and west sides of Chicago into different employment opportunities. So that's been a focus of ours. And in the wake of COVID, more than ever before, I think that becomes prominent. So if we go to the next slide. So I want to talk about a couple, on sort of the theme of this particular webinar, two different examples of how Skills is working with different stakeholders. The first one is local government. And again, I think this gets at the heart of really how, as an organization, in the wake of COVID-19, how there has to be an ability to quickly be agile, but also adapt to the new environment which we're in. And so in this particular case, we partner with the city of Chicago, and, as they pursued their response efforts around the field hospital at McCormick, the homeless shelters, and the isolation centers, and, working with hotels. And so there was different things that, as a nonprofit who's focused on workforce development, we had to quickly shift to. Number one is staffing, doing our part to make sure that we're supporting and bringing in the right individuals that are getting impacted by layoffs and those that are unemployed, and putting them in a position where they have employment opportunities with these three different areas that the city of Chicago was focused on. The second is around awareness to the broader community. So in the last month, Skills has been focused on how do we get the word out about all the fluidity of the jobs that are coming, the pockets of jobs and the job opportunities that exist today. And so it's bringing awareness to the broader community-based organizations, the local workforce system, and just finding any and every different avenue that we can share literally what's happening day in, day out. The other piece is around using data to inform. It's working with the city of Chicago to inform them around what are the hiring barriers that we are seeing, and perhaps what are the big wins that we can share back with the city of Chicago. Because again, when many employers are currently looking to hire at triple digits at a rapid pace, it's important to think about what are the existing barriers or minimum requirements, and do those still hold, weight in today's environment. And the last piece is, as an agency, we're also looking at how do we temporarily jump in, and where we're required or asked to, how can we manage the process, whether it's onboarding, payroll logistics, you name it. Right now, Skills is really opening up its portfolio of services and trying to adapt in wherever the need is. If we go to the next slide. So in the next slide, what you see here is a couple more examples of how we're working, in this case, with businesses and nonprofits and sort of combining a more holistic approach. The first one, really the emphasis here is around we're expanding to new partnerships. So, we, as part of a broader collaborative with Reimagine Retail, and there's a number of other nonprofits that support that, quickly worked on, getting an introduction to Walmart and then pivoting over to how can we support them? We know that publicly, Walmart as an essential business was looking to hire in the thousands nationwide. But locally, we worked to quickly assist them on not only within their local city of Chicago area, but also going from as close or near as Pullman to even locations out in Villa Park. And so what we've done in that particular case is we're pivoting to new demand. We're realizing that, this is an essential business. There's an opportunity here to really, for those that are comfortable, that have the opportunity and are seeking employment, because we recognize that everyone's in a different stage, but meeting employees and employers where they're at and being able to fill positions that are available. I will say that in today's environment, we are quick also to make sure that we're asking the right questions of employers about what they're doing during this moment. In the case of Walmart, I'm sure many of you seen publicly that they're creating one-way aisles to control and monitor traffic within their stores. They're only allowing so many people in at a time. So there's a number of different things that are being done by the employer, but also employees or those that are potentially going to be employees are asking similar questions. The last piece here that I wanted to lift up is around the impact that's happening at a much more local neighborhood level. And that is an involvement with Rush and Westside United. We know that Rush is the largest employer in the west side of Chicago. And so one of the pieces that Skills as a partner, along with, I know Rebekah's going to speak shortly on the Civic Consulting Alliance, but, we're engaged in that particular initiative and effort about truly creating pathways for our youth into certified nursing assistant roles. And so it's taking a holistic approach, and how do we ramp up those opportunities, along with making sure that the individuals going through this program are successful, whether it's mentorship assistance, educational assistance, but it's looking at a holistic approach and bringing in the right players to make sure that these individuals can be successful. Go to the next slide. So the last piece I wanted to finish off is by simply stating that, in this moment right now where the new normal, and even when shelter in place gets lifted, it's going to look and feel differently. And I think companies across the board are, whether they were ready for it or not, are adapting to the new environment and scaling the virtual platform at a level that perhaps they were not doing before. And so at Skills, we've invested a lot in our sort of background infrastructure to make sure that we're able to respond quickly. So we've gone completely virtual from the entire recruitment to onboarding process, and even our delivery of job readiness curriculum has gone virtual. The second thing is we're working with our community-based organizations, roughly 70 of them throughout the city of Chicago, to make sure that we're sourcing and pipelining talent, especially from those that don't have a voice or the right networks. The third piece is being a career navigator. Right now, we recognize that for the safety, there are a number of other organizations that have gone virtual. And our typical agencies that people would go to, such as unemployment office or American Job Centers, are closed. And so we want to make sure that throughout this time, Skills is helping to help individuals navigate how they can get to these different avenues on a virtual basis. And then the last piece is, being data informed and data driven. It is going to be critical during this time that we continue to monitor what's working, what's not working, what are the barriers to employment as we start to gradually return things and open up the economy. So I'll pause there.
Well, thank you, Daniel, for that presentation. And we are now going to move to a final case study. The Civic Consulting Alliance is working with businesses and the government, and in many ways is complementary to the two that we've heard about, because it's looking now longer term at, how do we move beyond this? And so, Rebekah, let me turn it over to you, and we're eager to hear the collaboration that you are leading as a new CEO of this organization.
Thank you, Seth, and thanks for inviting me to the panel today. It's great to be here. As Seth noted, I've been in this role for almost 6 weeks now. So my tenure has coincided with the start of our new working norms, and it's been quite a ride. And I'm pleased to be here today to share all the tremendous work that's going on. And as Seth noted, it's a nice complement to what Skills and United Way is moving forward. For those of you who aren't familiar with the Civic Consulting Alliance, we are a nonprofit organization marshaling collaborative pro bono investments to get big things done for Chicago. Our mission is to make the region a great place for everyone to live in and work. So how do we do that? We engage diverse people and resources to generate solutions to create a more prosperous and equitable city. And we do this specifically by engaging pro bono services from professional service providers, whether that's management consulting firms, law firms, accounting firms, etc. And they work in partnership with CCA to support both public sector and nonprofit clients. We focus our work in 3 key platforms. The first is economic vitality, working to grow an economy that is for everyone, education, elevating our education system, and public safety and criminal justice by building safer communities. Our experienced staff, best-in-class pro bono partners, and our deep public and private sector relationships allow us to solve old problems in new ways. We work to pinpoint the root causes of complex issues, and we convene institutional leaders and focus at a systems level to create the impact that benefits the entire region. So we're very committed to these cross-sectoral partnerships and ensuring a seat at the table for all stakeholders, working towards a more inclusive civic culture and creating the next generation of civic leaders in our region. Next slide, please. So how are we doing that at this time? How are we working to leverage that experience and position to help our region in this crisis? I would say on, I think, the 16th hour of my tenure, we started getting the calls from the city of Chicago for help, and then shortly thereafter from Cook County. And we mobilized rapidly to support these regional government partners to help them mount a comprehensive and inclusive response to the crisis. As you can imagine, every level of government is having to respond in multiple parallel ways to this crisis. First, of course, is addressing the immediate public health concerns, working to reduce the spread of the virus and managing a strong public health system and all the resources that it needs. And then in parallel, making immediate interventions and planning for long-term work to reduce the social and economic impact of the virus, and especially the impact of the measures taken to reduce the spread of the virus, namely social distancing and the closure of businesses. And then a third vein in all of this is working to address the structural inequities that underpin and exacerbate these first 2 aspects. And so it becomes quite circular. As I noted, we mobilized very quickly, and we've redeployed about 75% of our consulting staff to work on work streams supporting the region's response. And to date, we already have at least 8 pro bono teams working with us, serving the city and the county. So with this type of leverage model with private partners, our staff resources is amplified at least 3-fold by the pro bono commitments. There's really been an outpouring of support from our partners to support our internal team of about 31. Next slide, please. So more specifically, what are we doing to help in this response? We have more than 6 work streams going in this recovery planning and immediate crisis response. And I'll give some brief examples here. For the city of Chicago, we are working with one of our partners to support the city's public health management, working to model scenarios to predict the curve and efforts to flatten the COVID-19 curve, making sure that we have the right information to adapt capacity to provide care to evolving needs and demands and the type of sickness that's happening and the resources that are needed to respond to that. And then also planning for the transition from a strict shelter-in-place situation in terms of how the public health system has to respond to that. We're also supporting our partners at the city in identifying priority policy interventions to reduce the social and economic impacts of the crisis. So, for example, benchmarking at a national and international level, key policy-based interventions that should be addressed to help protect the most vulnerable sectors of society in the city. Third example is the city's racial equity rapid response teams that have been stood up very recently. Daniel highlighted West Side United, which is one of the partners that Civic Consulting Alliance has been helping to build as an organization on the West Side in the last few years. And they are part of the city's team where the city is mobilizing various community and data-driven rapid response teams to address the racial health disparities that we are seeing in the data of mortality in order to implement direct interventions to flatten the mortality curve in Chicago's Black and Latinx communities, and then again lay groundwork for future systemic change to reduce these inequities. At the county level, we are doing similar work to help identify priority policy interventions to address social and economic impacts. And we are also supporting their external stakeholder engagement to ensure that they are engaging effectively and leveraging their partnerships with the suburban Cook municipalities and their sister agencies, as well as the small businesses in the county. And then the third tier is working with the area's philanthropic community to ensure a good interface between government and the private sector resources available to the region to ensure that we're aligning our short and long-term investments across both the public and private sector to use available fiscal and thought leadership resources in the most efficient way. We're moving really quickly, at warp speed in this region right now. So this is a great opportunity to leverage the platforms that we have for partnership and bring in a diverse set of partners at the professional services and the private sector level. Next slide. And just in closing, looking forward, as we are shifting from this immediate crisis response into more of the recovery period, our work is focusing on supporting both regional economic recovery as well as recovery plans at a deeper level by agency. So for example, today, this afternoon, the city is announcing a recovery task force of public and private sector leaders that will be making recommendations to the city for the region's economic recovery. And this will be informed by a lot of economic analysis looking at the current and anticipated economic impacts of the crisis, as well as this task force will be informed by other key public and private sector expertise. We're also working with specific agencies within the city to help develop plans for reopening. For example, how will Chicago Public Schools develop a plan to support the district, schools, and their families to return and recover from the closure of schools? So this will require sustained cross-sector collaboration, and as we move well into the recovery period over the next months and years, and we must set the tone early that we have strong civic commitment and partnership between the private sector and the public sector. And CCA will be there to keep bringing these partnerships together towards this goal. So thank you very much.
Thank you, Rebekah, and thanks to all of our speakers. We are now going to move into Q&A, and we have a lot of questions that have been coming through the chat. And so we'll try to make these power round-ish in nature. And I'm going to start with a question that came through that I think is most of all directed to Elaine and Rebekah, but open to anyone. What resources does the public health system need from the business and nonprofit communities at this time? My sense from a number of the questions that have come through the chat, people want to help. They are business and nonprofit leaders, and they're thinking about, what role can we play? What's your advice? Elaine and Rebekah and others, if they have answers as well.
Rebekah, why don't you go ahead? It sounds like you're right at that table as people are talking that issue right now.
I'm sorry, I have to admit, I have a 4-year-old child who just interrupted me. So I totally understand.
Could I, Seth, could I
so
jump?
go for it, Daniel. Yeah,
Yeah,
we'll go to the
absolutely.
person that has his full mind available, understandably so in this moment.
Yeah, I think what I'll comment on my side in terms of the public health system is one of the pieces that, and I saw in the commentary, which at Skills we agree, is that I think as a community, we have to be aware that there's a second wave of unemployment that is likely going to hit us. you know, and right now in the moment we're responding, you know, or let me step back and say that, you know, we're responding to the current moment in terms of how the city and other employers that are part of the essential businesses, the need that they have. And so from a public health system, you know, one of the things that I'll say from a nonprofit standpoint, we could definitely benefit from PPE, right? For us, we see at some point, and I'll use McCormick Field Hospital as an example, you know, an ability for us to be on site along with other community partners to assist those individuals that once we're able to bend that curve, we're going to need to address what happens to them next. What are the next opportunities for them? Because it is a temporary working environment. When we start to bend the curve, many of those individuals will no longer be required in the capacity that they serve. And so, you know, I think nonprofits we're too small to be able to access the PPE that, you know, other large businesses as they are already having difficulties trying to obtain.
This is Elaine. I'll add in. If we look at other countries and the strategies they've taken to kind of keep things in control, a key thing that they've done working with businesses is redeploy forces in the whole area of case control or case tracing and management. And so I would imagine that local public health would want to know that if they are needing extra resources, hands and folks to be doing that community outreach and checking on people and being part of that case control, case tracing and management things, that the public health could be looking to outside groups to be an extension of that workforce. I think of it very similarly to how we think about the census, right? You know, you have a federal government that says now's the time we're doing the census, but there are these armies of folks that are out there that are facilitating and helping, working in community because they know their community as part of that. And so I would imagine we might see something like that unfold as a request. But Rebekah, you're closest to the table with it. You know, what are you hearing firsthand in the meetings that are occurring so far?
Seth, can you just repeat the question?
Yeah, it was around what resources the public health system is seeking from business and nonprofit communities. How are you know, the city and county that, you know, you're speaking with on a regular basis, how are they aiming to see business and nonprofits help them in this effort? I mean, and efforts that, you know, Elaine Morrato talked about, you know, contact tracing, making sure their workplaces are fully ready. Anything else that you want to add to that?
Another aspect is just the careful collaboration. As we move into the recovery period, the private sector is going to have a unique obligation and moral responsibility to be carefully following the directives of local and state government in order to reopen our economy in a safe and methodical way, and to be responsive to the realities that the public health system and potential future reemergence, they'll have to be responding very nimbly to that. So I think it's a very interesting time because it makes our sort of moral compass change in terms of our priorities, and individuals and business owners and civic partners have a much greater sense of the greater good right now in terms of their motivations. And so we need to continue to and maintain that goodwill in order to support our region and the health of its residents. So I see this as making sure people are building more trust in their institutions and working collaboratively there.
So another question that we've gotten on the chat is the role of academia. I just want to turn that over in particular to our two deans, although if others have thoughts, Sean, you're very connected with a lot of academic institutions. We'd love to hear kind of how you see a role for universities in this moment. Any of you can start.
Yeah, I'm happy to answer quickly and then let the real experts answer. But what I can tell you is, you know, the map that I showed you came from a researcher, you know, now at Harvard, and I think it's the research that Chetty has done, and the ability to display that research in ways that organizations can use has had a significant impact on philanthropy in the country. And I think there's a huge opportunity for academia to be an incredible source of information to help track, to help see what is working, that then allows philanthropy to put resources behind things that are working. None of us have the kind of resources or academic powerhouses that all of you have. And it's been just incredibly important for us to have that kind of data in our work.
Yeah, this is Kevin from Quinlan. You know, the idea of having force multipliers is really important now, and particularly for smaller businesses and smaller non-for-profits. So, and we have a wealth of expertise in-house on managing during difficult times, on managing cash flow, on using data to make decisions, and we are here to help. So if you contact me or Loyola in general, but contact me personally if you're looking for expertise. We have faculty and staff who are really eager to help. We're all in this together. This is our time to really partner with the community. So I make that that offer unreservedly.
Yeah, this is Elaine Morrato as well, and I would double down and echo on that. I think sometimes, and that was really a hope of this webinar series, is that we help to make it a bit more real time in the exchange of where needs are. So I know we'll be looking carefully at the chat as to the kinds of questions. I think from the academic side, sometimes we don't always know what's the most important question that the policymaker or the organization would be most useful. And so I wonder if there might be an opportunity to somehow, Seth, to elicit what those are. Maybe there's a follow-up to this where we can elicit what are the thorny questions that are top of your mind, that how might we look at resources at the campus that could help. The other area that we've been thinking a lot about at Loyola is our students, especially given student mission to the social good and make a difference. How do we help maybe our students get those skills that they can be that workforce that you're talking about, Rebekah and others, that would help in the public health response? And again, you know, how do we think about, we have the ability to do, you know, in the academic side, internships. Well, those internships can be ways that are directly, you know, pro bono work contributing. And I think where we need help is being directed by you all as to where can we add the most value right now. And I really, you know, and how do we best connect ourselves to where the key questions are so we can be most useful.
Well, so we have about 5 minutes, and I want to ask one final question with an aim for like a power answer of like 45 to 60 seconds. And that is, you know, as you look to the future, where do you see either the greatest opportunity for Chicago, or on the other hand, the next big challenge and how we overcome it? And Sean, in particular for you, John Edelman has a question in here about how we start to move forward some of these collective impact efforts, you know, from both a bottom-up and a top-down perspective. So I'll leave that as a broad question and give each of you kind of a parting shot here to share with the audience. And maybe since we started with you, Kevin, originally, we can go back to you for your parting shot on this.
Yeah, thanks, Seth. Something that's worked very well here at Quinlan is our Supply and Value Chain Center and our Family Business Center. And what they do is provide organizations a safe place to come and talk and share best practices. And that's one, and perhaps worst practices, what failed. So one thing we'd like to offer is our support. If people out in Zoom land want to talk to their counterparts and share what they've learned, this is really the time for us to band together, and we'd be happy to help facilitate that. Thank you.
Dean Morrato?
Yes, I was just responding in the chat room. Similarly, you know, reaching out directly with needs to me directly, we can help. I think the biggest short answer, though, to what's the power question for Chicago is having more. It was exciting to hear the speakers here today and to hear all of the activity that's going on. And I think it would be really great to, how do we best communicate the collective activity that's going on so all those citizens really know what is being done? I think that's a big opportunity. That made me feel a lot better just hearing it on the session today.
Thank you. Me too. Sean?
Yeah, so I'd say, so I'm not sure what the next big one, but I would say that the opportunity we have is in the last 6 weeks, an incredible number of new capacities have been built. New partnerships are forming every day. Organizations are doing things that they've never thought about doing. And instead of letting things get in their way, they're responding and doing what they need to do. So I think the opportunity is we're innovating faster than we've ever had. And we're also working together more collectively than we've ever had at every level, whether it be the kind of top down or bottoms up. We're seeing it across the board. And I think that the opportunity is, how do you keep driving that and not say we're out of it, but instead say, what did we learn and how are we resetting this as the new norm? And the expectation is that we work in these ways, maybe not on Zoom all the time, because I might be tired of that, but that we find the ways and collaborations and we keep and stick with them instead of return back to something that frankly wasn't working to the level it needed to change the inequalities in our community.
Daniel?
Yeah, I'll keep it simple with, I'll give one opportunity and one challenge. One opportunity is just the unbelievable generosity and how quickly together philanthropy has come together to address phase one, the relief efforts. And I think it will be interesting, and I look forward to the recovery effort and to be able to sort of look at philanthropy, how they champion and assist in the planning to support those needs. In terms of a challenge, I would say that prior to COVID, progress was being made on hiring returning citizens, opportunity youth. But in the wake of COVID, that is a challenge, I think, as we move forward, especially given that supply will absolutely exceed the demand of jobs out there.
Rebekah, final word.
Thanks, Seth. I think both the challenge and the opportunity is regarding economic recovery. And while we need to ensure that we come out of this and rebuild a strong economy, we have the dual mandate that it be an inclusive economy. And I think it's easy to get into the mindset of thinking we just have to get back to what we were like pre-COVID, this sort of sense of, get back to normal. Well, pre-COVID wasn't working either for many sectors of our region. And so this is the challenge, how to use this moment as a transformational moment to really achieve a number of the broader structural changes to achieve our policy goals. So for example, Mayor Lightfoot's agenda to eradicate poverty in the city, that is an amazing goal. And how do we use this opportunity to leverage the partnerships we have to catalyze the change that's needed to achieve it? That is the place we're at. There's no time for small goals right now.
Well, let me just close by saying how inspired I am by all of you and to say thank you. I think the idea that Abigail shared in the chat, that the most important next step is that we not go back to normal, that we, as you said, Rebekah, we use this moment. We have seen so far in COVID 6 Blacks dying for each white, and that is a reflection directly of the inequities that existed prior to COVID. And I think that this has given us a chance to flatten more than just one curve. And thank you all for being part of that mission. Thanks to everyone who is with us for being part of this mission. And given that we learned on this webinar, we will all be at home until at least May 30th. We look forward to hopefully seeing you for future webinars, given none of us have anywhere to go. But on a happy note, hopefully we can move the needle so that when we do have somewhere to go, we can go back to a world that is better than the normal that we left. Thank you all, and we look forward to future collaboration.
Thank you. Thank you all.